What that means is, as we experience this, is you send that text message out into the ether and nothing comes back, or you send out a fax and there's nothing comes back. I think fundamentally, and this is like going to be the common theme here, is that the I-SNP model is much more likely to create a partnership between the SNF operator and staff, the health plan, which is bearing the financial risk, and the care provider that is in your building, in a way that completely eliminates this idea of the communication black hole. We have seen that in many different areas, from having to wait for any type of prior auth to having to wait for a decision around, like, I think there might be a UTI here, doc. Like, do you recommend antibiotics? Like, the timing goes from, again, days to like minutes. And it's just because you become part of the same team. And because you're not always in the building, you are more likely to have that clinician in the building much more frequently than any other model. But still, you need a communication channel that serves you. Sometimes it's even like, look, you're in a room down the hall and this person's in that way. Like, how do you communicate efficiently without yelling down the hall to each other? And that's where you're much more likely to identify this need and then choose a solution, whatever that might be. And then it becomes just the standard of how you talk about the care needs of the residents that you're serving. And so, that comes to mind when you bring up the kind of black hole concept. Like, it just goes away. And look, like, when if it's there and it's an issue, like, you actually feel like you have a partner where you can sit around the table and be like, hey, let's address this. Like, let's figure, because this is hard work, and like, there is turnover of staff. And so you need to have a partner that's going to be willing to come to the table when things are working and when they're not. And then be committed to solving and addressing when things are not working. And I think in an I-SNP model, you're much more likely by far than anything else to get that. And so when we see that happening, you just get a lot of the things that we've been talking about. Like, you get the better experience, you get the reduction in unnecessary hospitalization, you get the reduction in wait times for care services that your staff is trying to coordinate.